Life before my reconstructive surgery was difficult. As a young girl facing congenital amastia, where essentially I didn't have a breast on one side, middle school girls are cruel. I was so frightened by people finding out my secret. I was in hiding. That's basically the best way to say it. I didn't want to go to sweet 16s or bar bat mitzvahs. I just didn't feel comfortable being around other teenagers. 30 seconds can change your life. A slip of my gel insert falling, essentially, that could have made me an outcast.
I think when you first give birth, you count the toes and count the hands and the fingers and the ears, and you never expect that later on in life you're going to be facing what we face together. She actually kept it a secret from me for a lot of years.
I met Dr. Alizadeh. He has this big smile, huge, huge smile. And he was like, okay, this is the game plan. This is what we're gonna do.
The first stage, we would have to go in and put a tissue expander to help stretch the skin. And then that would be followed by exchanging to a permanent implant that would help match the opposite side. What was remarkable during our interactions was that she was always prepared. She was well educated about what the nuances were, what the alternatives were. As a matter of fact, she would be sort of coaching me as to what I should be asking her.
Dr. Alizadeh's office and everyone working there essentially gave me that dignity that I was looking for, that my condition wasn't something to be embarrassed about.
The only change that I could tell you that I saw in Ciara was just wanting to make a difference.
Mission Restore is a 501c nonprofit organization that focuses on surgical training and development in third world and developing nations. Given my experience as a reconstructive patient, I understand how important it is to have adequate reconstructive and cosmetic surgical care on a global scale. So working for an organization like Mission Restore essentially puts into perspective how important it is to have trained surgeons and how important it is to have properly educated surgeons globally. There are so many patients all over the world that do not have access to adequate surgical care.
Every year, more people die from lack of access to surgical care than HIV, malaria, and tuberculosis combined. It's over 18 million people. We go into countries like Kenya or Tanzania. We find hospitals that have a large need, and we work directly with these young surgeons who are talented but haven't had the training and mentorship to really address the needs that they're seeing every day. Within the first month, Ciara had organized an educational campaign at her high school, educating all of her fellow students about the global health challenge of surgical access. She had raised over $4,000, and she had organized a rally with press to highlight the work that Mission Restore is doing. In 2016, Ciara is launching the Mission Restore University Chapter model, which is going to bring Mission Restore to students in universities across the United States. She was also elected the president of our Young Professionals Board, which is really impressive, and she's already taken an incredible leadership role in engaging young professionals in the work that Mission Restore does.
The feeling that my fundraising efforts are aiding patients across the globe who are facing debilitating injuries, and with Mission Restore's work, essentially they're getting life-changing reconstructive surgery. That feeling is it's greater than anything else in the world. I don't think I've ever felt so fulfilled in my life. This is the happiest thing that I've ever done. It makes me feel as if I'm actually making a difference in the world.